What do I do for a living? I am a clinical psychologist and the co-owner of WGM Psychology and Associates. I work primarily in our clinic with people who have been through traumatic events and who have been diagnosed with post-traumatic stress disorder. I went to Stanford University, where I was able to take both a master's and a doctorate level degree of schooling to become a clinical psychologist. And while I was in California going to Stanford, I had an even greater opportunity of being able to work for several years at the National Center for Post-Traumatic Stress Disorder, which is a program funded by the Veterans Affairs Administration, and that allowed me to work with both men and women who had experienced traumas of various kinds. I often am asked by the kids in my life what I do for a living, and when they ask me, I say that I am a doctor of feelings. And that means that people come to see me to help their feelings get better. Is there anything I want people to know about what I do? I think probably, and this comes from something that I hear from my patients often, is that coming into a first therapy session can be intimidating and it can be a bit scary. So probably what I would like people to know is that, it's probably not as scary as it might seem, and that, assuming you have a caring, trained psychologist in front of you, hopefully it's actually going to feel kind of like a relief and as though it's a safe place to come and talk about whatever is going on. So I think I'd probably like to demystify the idea of therapy somewhat and have people understand that really it is about a relationship, a working relationship between two people in the service of helping them to feel better.